So good morning everyone. Today we are here to discuss about the sectional anatomy of thorax. So we are not going to see all the sections of the thorax. Only at two levels we are going to see the sections. One at the level of T8 vertebra and another at the level of T11 vertebra. Another section we are going to study about the region of 11 vertebra. And after that, we will proceed for the mid-sagittal section of pelvis, means male pelvis and female pelvis. So, how to differentiate these two pelvises section? The mid-sagittal section. So, before going to the sectional anatomy, so what is it? So, this will come under the radiology. Okay. So, sectional anatomy. It is subjected to identify and learn the normal body structures in sectional planes. So we are going to study the structures present in our body by studying them in a plane. So we will cut the body in planes and study the structures present in that plane. Okay. Usually we will prefer the structures in a horizontal plane. So planes are three types. Yes, the horizontal or transverse plane, vertical plane, and an oblique plane. So usually we will prefer the horizontal plane for the sectional anatomy. Okay. So this sectional anatomy again, we can study the sections either by gross or by radiological expert. So if we make a section of a cadaver and study, that is also a sectional anatomy. And if we will go towards the clinical side, if we take an MRI or CT and study that section, that is also a sectional anatomy. So we can study that sectional anatomy by means of gross structure or through a imaging technique. Okay. So whatever section we are going to study, that we will call it as cross section. Okay. So what is this cross section? So it is obtained by slicing, okay, the body or any part of body structure in a horizontal way. As I told you earlier, so we will slice the body or any part of the body structure either through gross section or through imaging technique. We can use a gross section, okay, or through imaging technique. So we are going to get a cross section. And usually these cross sections are preferred in horizontal plane only for comparison. Okay. And this cross section is also called as axial section. Okay. So we will study the sectional anatomy by means of cross section. So this cross section can be obtained by just cutting the body, okay, or by obtaining the imaging, a film, either CT or MRI. Okay. Either by cutting the body or by using the imaging technique. We are going to obtain a cross section and we will study the structures present, different structures present in the cross section, and we are going to compare. Okay. So first, as I told you, we will study in a thorax two levels, one at the level of T8 vertebra, another one at the level of T10 vertebra. Okay. Okay. So first we will see at the level of T8 vertebra. So this is a horizontal plane which passes through the T8 vertebra. So first we will see the gross section. Okay. So in the gross section, so these sections, they are visualized from below. So means this is the right. Okay. So this is the right half, this is the left half. The sections are studied from below. Then this section, this is the right half of the body, this is the left half of the body. Okay. So in this section, you can make out first the skin. Okay. And the bones that is visualized, this is the thoracic region. So this is the T8 vertebra. This is the body of the T8 vertebra. These are the transverse process and this is the spinous process. Okay, body, transverse process of the T8 vertebra and this is the spinous process of the T8 vertebra. And enclosed by the body, this is a vertebral canal. Okay, in which you will see the location of the spinal cord. Okay, the thoracic part of the spinal cord is present here. Okay, so this is the posterior aspect. Come to the anterior aspect. In the anterior aspect, you are going to see the body of the sternum. Anteriorly, this is the sternum. So at this section, you will going to see the section of the body of the sternum. Okay, and laterally you can see multiple fields of bone. Okay, so multiple section of bones you can see. Okay, this one, this one, this one, this one. All these are the ribs. They are the cut section of the ribs. So why there are multiple sections, not a single one? Because the ribs are oriented obliquely. Okay, so they will cut. So different ribs are cut in this section, and they will appear as a different fields. Okay, and in between those are the intercostal muscles. Okay, and here is the, so these are the ribs. In between these are the intercostal muscles, and anteriorly these are the pectoral group of muscles. Posteriorly these are the back muscles, mainly the trapezius. Okay, and laterally this is the latissimus dorsi. And as it is a region of the thorax, you are going to see the thoracic cavity, and here the thoracic cavity is filled with heart and lungs. So the two plateal fields, these are the two fields of the lungs. This is the right lung and this is the left lung. Okay, here you can make out this fissure. These are the fissures. So these are the fissures of the oblique fissure of right lung and the left lung. Okay, and come to the median structure. Just behind the sternum, you are going to see the section of the heart. Okay, so this is a section of the heart. In this, you can make out this is a right atrium. Okay, whereas this is the right ventricle. This is a left ventricle. Okay, so there are three chambers here: right atrium, right ventricle, left ventricle. So here, this is the right atrioventricular orifice. You can see the valves. These are the valves. Okay, that's for the valve. So this is the right atrioventricular orifice. Okay, guarding the guarding between the right atrium and the right ventricle. So this is the right ventricle. Okay, and this is the left ventricle. You can compare the wall of the ventricle. See, the right ventricular wall is thin when compared to the left ventricle. Okay, and just behind the heart, you are going to see the tubular structure, that is the esophagus, and behind that you are going to see the descending thoracic aorta. So this is the descending thoracic aorta. Okay. So how to read a section? So this is a cross section at the level of T8 vertebra. First we will go for the bony process posteriorly, and you should remember that these cross sections, they are visualized from below. Means this is the right half of the body, this is the left half of the body. Okay, this is anterior, this is anterior, this is posterior. So posteriorly, as it is a thoracic region, so this is the T8 vertebra. Body, vertebral canal, the transverse process and the spinous process. Later you are going to see the ribs, cut sections of the different ribs. Anteriorly there is a body of the sternum. And in between the ribs you are going to see the intercostal space with the intercostal muscles. Okay, so here you can make out that rib is articulated in the body of this vertebra. Costal vertebral joint. Okay, and here it is also articulated with the transverse process. Costal transverse joint. Okay, so the two joints here. Next, we are going to see the muscles. What are the muscles present? Anterior to the sternum, the pectoral group of muscles, and just behind the body, nothing but the vertebra. Okay, behind the vertebra, you are going to see the trapezius muscle, and beneath it, on a deeper plane, you are going to the erector spinal group of muscles. And actually, there is a latissimus dorsal muscle. Okay, latissimus dorsal muscle. And when you go into the middle, area of the section. Usually you can see, as it is thoracic region, it is occupied by the lungs. Okay, these are the two lung fields. This is the right lung field, this is the left lung field. And here you can make out the oblique fissures of the two lungs corresponding lungs. Okay, and there is a section of the heart showing the three chambers, right atrium, right ventricle, left ventricle. So how to differentiate between the two, between the right atrium and left right ventricle? Here you can make out the atrioventricular orifice, right atrioventricular orifice here. You can see the cusp of the right atrioventricular orifice. Then this is the right ventricle, this is the left ventricle. How to differentiate? By the thickness of the wall. Okay, left ventricle is thick walled. Okay. Next, behind it, we're going to see the tubular structure, which is curved in a cross section, that is the esophagus, and behind it, you are going to see the thoracic aorta. Okay, so these are the structures visible in a cross section. So now we are going to compare it with the CT image. Okay, so same, this is a cross section, this is the CT image. So in the CT image, you can see the bones are white in appearance. Okay, whereas the air filled spaces, the lungs contains the air, they are black. Okay, and the rest is grayish in color. So bones white, air filled structures black in color, and others in the shades of gray. Okay, so we can compare here. So this is the right half of the body, this is the left half of the body. So first, this is a P8 vertebra, body, vertebral canal, transverse process, spinous process. Okay, and these are the back muscles present here. This is the body of the sternum, and these white fields, okay, different sections are the ribs. Okay, these are the ribs. Okay, multiple sections of the ribs because the ribs are oriented in oblique direction. Okay, next, what you can see, these are the lung fields. Same here. These are the two lung fields, right lung and left lung. Same here, right lung and the left lung. Why the lungs appear black in color? Because they are air filled, and the air will not absorb or so whatever the rays are passed through the lungs, they will not reflect, but it will pass through it. Okay. Only where the rays are reflected, they appear as white in color or in the shades of gray. Where they are transparent, means rays are not absorbed or not reflected, they appear in black in color. Okay, so this blackish area field is a lung field. Okay, next come here. So you can make out this one is right atrium, 2 is the right ventricle, 3 is the left atrium here, 4 is the left ventricle, here 5th one is the left atrioventricular or aortic valve. Okay, left atrioventricular outflow tract of the aortic and the aortic valve area. So behind it, I told you this is the descending thoracic aorta, this is the esophagus, and here this small structure, that is the azygous vein. Okay, this is the azygous vein. Okay, so you can compare these two structures here. Okay, now, so in a CT is mostly preferred for bones. Okay, so which structure is highlighted in a CT means the bones are very much highlighted in a CT. You can observe clear-cut image of bones in a CT. So whenever there is a need of assessment for bone, means you have to find out a fracture of bone, okay, any abnormality of the bone, we will go for the CT image. And if you are interested to know about the gross structures of the soft tissue, we will prefer an MRI over CT because MRI is mainly meant for the soft tissue. The soft tissue is better visualized in an MRI. Okay. So that is about the section at the level of T8 vertebra. Next, we will see the section at the level of T10 vertebra. So here, so we are moving down. So here, what we will see. So this is section at the level of T10 vertebra. So in this cross section, what are the gross structures we are going to see? Same. This is the posterior aspect, this is the anterior aspect, this is the right field, this is the left part of the body. Okay, this is the right part, this is the left part. So here you can see the body of the T10 vertebra, spinous transverse process, spinous process, vertebral canal consisting of the spinal cord. Okay, same as the previous one. And at this level, T10 vertebral level, we are going to see the deferred process of the stomach, not the body. At the T8 vertebral level, we are going to see the body of the stomach. Whereas at the level of T10 vertebra, we are going to see the Ziphysternum deferred process. Okay. And the same, the different sections of the ribs with the intercostal muscles. Okay. And these are the back muscles. These are the back muscles. And here you can see the serratus anterior muscle also. Okay. So when we go to the interior, what is present in the middle part of the section? See here, as we are approaching towards the abdomen, here you can see the section of the liver. Okay, this is the right lobe of the liver. This is the section of right lobe of liver. And here you can make out behind it. Again, you are seeing a dark area. This is the right lung, the lower lobe of the right lung. This is the lower lobe of the left lung. Okay, so at this level, you are only going to see the lower lobes of the two lungs. Okay, so on the right side, it is on the right and left side, it's separated by the diaphragm. So this oblique line is the diaphragm. Okay, so this diaphragm separates the abdominal viscera from the thoracic viscera, as you know, as it is a thoracoabdominal diaphragm. Okay, so in between these two, this oblique structure is nothing but the diaphragm. Okay, so this is the right lobe of the liver. Next, what you are going to see is this. At this level, we will see the section of the stomach also. This is the esophagus and this is the fundus of the stomach. So this is the cardio-esophageal junction. Cardio-esophageal junction of the stomach. Okay, and in between the stomach and the lower lobe of the left lung, you are going to see the spleen. Okay, between the fundus of the stomach and the diaphragm, the spleen is sandwiched. So this structure is a spleen. Okay, so this is the esophagus, this is the fundus on the cardiac part of the stomach. Okay, and this is the spleen. And behind the spleen, this is the left dome of the diaphragm. This is the left lower lobe of the lung. Okay, lower lobe of the left lung. Okay, next, here we are going to see that this tubular structure is the inferior vena cava. This is the descending thoracic aorta. Here is the azygous vein. Okay, just in front of the vertebral body, T10 vertebral body, you are going to see the azygous vein and the thoracic aorta. Thoracic aorta on the left side, azygous vein on the right side. As I told you, you should study a cross section in a as if you are visualizing from below. So this will be the right half, this will be the left half. So in this section, what are the additional structures you are seeing? So only the lungs, the lower lobes of the lungs are visible and rest is occupied by the abdominal viscera. On the right side, right lobe of the liver. On the left side, you will see the stomach, cardio-esophageal junction of the stomach, and in between the stomach and the left lobe of the liver. Lower lobe of the left lung, you are going to see the spleen. Okay, sandwiched between the stomach and the diaphragm. So this is the left dome of the diaphragm, and this is the right dome of the diaphragm. Okay. So now we will compare this one with the CT image. Same that gross section. Okay. So this is the liver, right lobe of the liver. This is the right dome of the diaphragm, right lower lobe of the right lung. This is the lower lobe of the left lung. This is the left dome of the diaphragm. This is the spleen. This is the stomach area. Okay. This is the inferior vena cava. This one will be the descending thoracic aorta, and here is a azygous vein. Okay. So now we will compare this one with the CT image. So in a CT film, at the level of T10 vertebra, we will go to see. As I told you in the CT film, the bones are clearly white in color. So this is the fleet and vertical body with the transverse process and the spinous process enclosing a vertical canal containing the spinal cord. Okay. Next, this is the Jiffy sternum. Jiffy sternum. And laterally, these are the cut sections of the ribs. Okay, on either side. In between, connecting them, there is a intercostal space containing the intercostal muscles. Okay. Next, come to the middle part. So this one is the right lobe of the liver. Right lobe of liver. And this blackish area is the lower lobe of the right lung. Okay. Same here. This one is the lower lobe of the left lung. Next, what you are going to see here is this one is the esophagus. So this is the fundus of the stomach. So this will be the cardio-esophageal junction. Okay. This three will be the inferior vena cava. This one is the recurrent thoracic aorta, and this small structure you can see here is the azygous vein. Okay. So in between the fundus of the stomach and the diaphragm, dome of the diaphragm, which dome? Left dome of the diaphragm. So this viscus is nothing but the spleen. Okay. So at the level of T10 vertebra, you are going to see the three abdominal vessels. One is the right lobe of the liver. Next, the cardiac part of the stomach or the cardiac junction in this spleen. Okay. So next section is at the level of L1 vertebra. So this L1 vertebra is very important because it is the level of transpyloric plane. Yes. So this transpyloric plane, it will pass through the pylorus of the stomach, and it is very important because many structures they are located in this transpyloric plane. First one is the pylorus of the stomach. Then you will see the neck of the pancreas, fundus of the gallbladder. Okay. Next, you will see the ending of the spinal cord here. Okay. Next, you will see the cisterna chyli, formation of the cisterna chyli here. The formation of the portal vein will be here. The portal vein is formed by the union of splenic vein with the superior vestibular vein. When the superior vestibular vein is joined with the splenic vein, it will lead to the formation of the portal vein. Okay. Next, the origin of the superior mesenteric artery. Next, the root of transverse mesocolon will pass here. Then there are the two flexures of the colon, hepatic flexion and the splenic flexion, nothing but the right and the left flexures of the colon. Okay. So all these important structures, they are located at the level of transpyloric plane, and this transpyloric plane you can locate at the level of L1 vertebra. Okay, so that is the importance of L1 vertebra because it is a site for the location of transpyloric plane, and in this transpyloric plane you are going to see the lot of structures, important structures are there, and you can locate the hilum of the spleen and kidney also at this level. Okay, so I have listed these many structures are present here. Okay, altogether there are overall 15 structures are present at the level of transpyloric plane. Okay, so you can see here, this one is the L1 vertebra. Okay, body, next transverse process, and the spinous process, vertebral canal enclosing the spinal cord. Okay, next you can see this is the ribs, cut sections of the ribs. Next, what you are seeing here is these are the kidneys. So hilum of the kidney, corresponding kidney is located here. Here is what is this? Liver. Okay, with the fundus of the gallbladder. Okay, the coils of the jejunum. This one is a descending thoracic, not thoracic. This is abdominal aorta. Okay, and Here you will see the inferior vena cava with the renal veins. Okay. This is the location of the stomach. Okay, here this is the left lobe of the liver. This is the colon. Okay, and this is the pancreas. Neck of the pancreas is located here. Okay. See, if you observe a section in a cadaver, it will be like this. Okay, this is the L1 vertebra, first lumbar vertebra. Okay, next anteriorly there is no bone, but here you can see the linea alba. Okay, at the T8 and T10 level, we are going to see the parts of the sternum. Okay, body and the Ziffert process respectively. But here there is no bone, but you can see the largest raphe for body, that is the linea alba, which indicates the aponeurosis of the abdominal muscles. Okay, on either side of the linea alba, you can see the rectus abdominis muscle enclosed in the rectus sheath. Okay, more laterally the ribs, the intercostal muscles, and externally covered by the abdominal muscles. Okay, muscles of the abdominal wall. Okay. So next, in front, just in front of the, on either side of the body of the L1 vertebra. So this muscle you are seeing. So this muscle is rectus abdominis muscle. Rectus abdominis. Sorry, sorry for the mistake. This one is a psoas major muscle. Okay, just on either side of the body of the L1 vertebra. This is the psoas major muscle. Okay, on either side of the body, we are going to see the hilum, corresponding hilum of the kidney. This is the hilum of the right kidney. This is the hilum of the left kidney. Okay, in this kidney section, you can make out the outer one is cortex, inner one is the medulla, the hilum. Okay, same here, cortex, medulla. Okay. Next here is the abdominal aorta in front of the body of the L1. And you can see the origin of the superior mesenteric artery here. And in front of it, this is the location of the superior mesenteric vein. Okay. And here, this is the hepatic area. This is the right lobe of the liver. And left side, this is the spleen. Okay. Rest are occupied by the other parts of the small intestine or large intestine. Okay. So these three sections are of large intestine. And these are the sections of the small intestine. Okay, these are the sections of the small intestine. Here is a pancreas. Okay, and this is the vena cava. This is the location of the inferior vena cava. So at the level of L1 vertebra, mostly you are going to see the different viscera. So what are the viscera visible here? The small coils of small and large intestine, the corresponding kidneys, spleen, liver, along with the abdominal aorta, inferior vena cava, superior mesenteric vein, superior mesenteric artery, pancreas. Okay. So these are structures visible here. Same here. If you observe a CT, so the bones will appear white in color. So these sections of the ribs. This is spinous process of the L1. This is the body of the L1. And those in the vertebral canal consisting of spinal cord. Okay. So these two are the rectus abdominis muscle of either side. Okay. And these are the muscles. Intercostal muscles along with the abdominal wall muscles. And these are the back muscles. Okay. These are the back muscles. And these two are the psoas major muscle. Okay. And just on either side of the body of the L1 vertebra, you are going to see the kidneys, corresponding kidneys with the hilum. Okay. So these are structures entering into the hilum of the left kidney. Okay. Now, next, this is the area for the spleen. This is for the liver, right lobe of the liver. Okay. And this white one are the colon. This is the section of the transverse colon, descending colon. Okay. Next, in front, this is the abdominal aorta. Then you will find the inferior vena cava here. This is the abdominal aorta giving origin to superior mesenteric artery. Okay, superior mesenteric artery. And the rest are the cords of the small intestine. So these are the cords of the small intestine. Okay. So at the L1, as we are in the abdomen, so we are going to see a lot of structures, the viscera present in the abdomen. Okay. So you can clearly identify these structures. Okay, na? On either side of the body of the L1, you will see the corresponding kidneys, the right kidney and the left kidney showing the hilum. Okay. Then on the left side laterally you are going to see the spleen. On the right side you are going to see the right lobe of the liver. Okay. And just in front of the body of the L1 you are going to locate the body structure. This is abdominal aorta giving origin to the superior mesenteric artery. Just in front of it you are going to see the inferior vena cava, and in front on either side of it you are going to see the walls of the intestine, mainly the jejunum. And on the right side, not on the right side, on the left side you are going to see the large intestine, parts of the large intestine. Okay, this is the part of transverse colon, this is the descending colon. So that's about the cross sections of the thorax. Two cross sections, one at the level of T8, one at the level of T10, and another section of the abdomen at the level of L1 vertebra. Okay, so it's not exactly at the level of L1, it is between T12 and L1 because I can't get the exact picture. Okay, next we will move on to the sections of the pelvis. So usually we will prefer the mid-sagittal section of male and female pelvis. Okay. So what are structures present in this mid-sagittal section? Okay. So what are the structures we are going to say from anterior to posterior? First, we should say for the bones. So this one is the pubic symphysis. Anteriorly, you are going to see the pubic symphysis. Posteriorly, you will see what is the structure. This is the sacrum. Okay, consisting of sacral canal, and this is the coccyx. Okay, so anteriorly pubic symphysis, posteriorly sacrum with coccyx. These are the two bony structures guarding the pelvis. Okay, next, so this is the pelvic cavity. So within the pelvic cavity, you are going to see the pelvic viscera. So what are the structures? As it is a male pelvis, we are going to say first structure is the either it is male or female pelvis. First structure just behind the pubic symphysis will be the urinary bladder. So this is the bladder, and this is a fold of peritoneum connecting the bladder with that of umbilicus. So this will be the median umbilical ligament. Okay, median umbilical ligament. Okay, so this is the bladder. Next, behind the bladder, you are going to see the rectum. Above the rectum, this is the sigmoid colon, this is the rectum, then which continues as the anal canal. Yes, anal canal. Okay, so and this is a pelvic organ, and above there is the abdominal cavity. So this abdominal cavity is lined the peritoneum. So this peritoneum also lines the this pelvic viscera. Okay. Okay, and when it lines the pelvic viscera, it reflects as a pouch here. So you can see after covering the lateral and anterior aspect of the rectum, okay, it is reflected onto the bladder, and from there it is reflected onto the anterior abdominal wall. So this is forming a fold of peritoneum. Okay, so this is a rectovesical pouch. Rectovesical fold of peritoneum. Only a single fold in case of males, rectovesical fold of peritoneum. Okay, and here what you can see, this one, these two are the ureters, okay, which are coming from the kidney, okay? From the corresponding kidney, they will open into the lateral angle of the, on the lateral aspect of the bladder, one on each side, one on the right side, one on the left side, okay. And crossing this between the ureter, You can see this tubular structure. What is this tubular structure coming? It is coming from the male internal genitalia, nothing but the testes, male gonads. So the duct of the testes, the vast difference, okay, the vast difference is coming, okay. So this is rectus difference, okay. Now, next, it is joined by, here the structure you can see, this is a seminal vesicle. So it is, the vast difference is joined by the duct of the seminal vesicle, and both together will form the ejaculatory duct. Okay, so this ejaculatory duct is formed within the prostate. So this is a prostate gland. So this ejaculatory duct, it will unite with the this part. This is the urethra. Which part of the urethra? As it is enclosed by the prostate. So this is the prostatic part of urethra. So it opens into the prostatic part of urethra. Next, so here it is a common passage for both the secretion from the urinary bladder and secretion from the main genital system. Both the secretions are mixed together and they are carried through the rest of the part of the urethra. Okay, rest of the part of the urethra. Okay. So come here. This pouch is nothing but the scrotum consisting of the male gonad, nothing but the testes. So this whole structure is the testes, and overlying it is the epididymis. Okay, epididymis having a head, the body, and tail. From the tail, you will see the origin of the ductus deferens. So what is the trait of ductus deferens? So this ductus deferens unites with the duct of the seminal vesicle, forms the ejaculatory duct. This ejaculatory duct opens into the prostatic part of urethra, and at this site, this is a common passage for the both urine and the semen. Okay, secretion from the kidneys and secretion from the male. Both are mixed here, and they are carried to us same or single urethra. Okay. So that is here. So this massive structure, okay, which is present below the bladder is nothing but the prostate gland. Okay, this is the prostate gland, and here this accessory gland you consider bulbourethral gland. Okay, bulbourethral gland, and this one is the penis consisting of corpora cavernosa and corpora spongiosum. Okay, this is a bulbospongiosum muscle. Okay, so behind you can see this is a rectum which contains the anal canal. This is the site for the external anal sphincter. External anal sphincter. Okay, external anal sphincter. Okay, so from anterior to posterior, pubic symphysis, bladder. Okay, you will see the ureter, in between vast difference, next seminal vesicle. Okay, rectum. Rectum below contains anal canal, opens as a anus on the exterior through external anal abutments. Okay, so this prostatic part of urethra joined by the ejaculatory duct, then it contains a membranous urethra, then it's a canal urethra. Okay. So as I told you, for soft tissue structures, we will usually prefer the what? MRI. So this is the MRI of a male pelvis. Okay. You can locate the, this is the penis. Okay. This one is the pubic symphysis, and behind this is the sacrum with coccyx. Okay, sacrum with coccyx. So the pubic symphysis anterior, posterior coccyx. So what is the anterior most behind the pubic symphysis? You are going to see the urinary bladder. So this is a bladder. Okay, this is a bladder. Behind the bladder, this organ, nothing but the seminal vesicle. This is a gland, seminal vesicle, and this massive structure is the prostate. Okay, so this is the prostate. So these are the coils of the sigmoid colon. Next contains the rectum, and then is a anal canal. Okay, so in this section you can make out these structures. Okay, pubic symphysis, urinary bladder, seminal vesicle, prostate gland. This is the urethra. Okay, traversing the penis. Okay, and you can see the Coils of the sigmoid column containing as a rectum and which contains as an anal canal. Okay. So come to the section of the female pelvis. Already we have seen the section of the male pelvis. So this is the mid-sagittal section of the female pelvis. The bony landmarks are the same. Anteriorly, you are going to see the pubic symphysis. Posteriorly, you are going to see the sacrum with coccyx. Okay, these are the lumbar vertebrae. This space is the sacrum and this is the coccyx. Okay, so the anteriorly pubic symphysis, posteriorly sacrum with coccyx. Okay, so in between, what are the structures? Same urinary bladder. Okay, posteriorly rectum with, this is the rectum with anal canal. In between, okay, as it is a female pelvis, additionally you will see the female genitalia. Okay, female genitalia, internal genitalia will be present here. So you can make out this structure. This is the uterus. Okay, and this is the vagina which opens exteriorly. Okay, so what are the structures? I will explain now. So this is a bladder. Okay, and this is the urethra opening through the urethral orifice to the exterior, to the vestibule. Okay, again this is the median umbilical ligament. Okay, from the apex of the bladder, and this is the uterus. So uterus having parts. So this part is the fundus of the uterus. This is the body of the uterus, and this is the cervix of the uterus. Okay, fundus, body, cervix. So this cervix having a supravaginal and vaginal part, above the vagina and within the vagina. Okay, supravaginal part and the vaginal part. So this cervix opens through a nose into the vaginal cavity. Okay, so this vagina is nothing but the birth canal. Okay, cervix opens into the birth canal, and here you can see these two. These are the fornices. Anterior fornix and the posterior fornix of the vagina. The posterior fornix being the deepest. Okay, so this is the vaginal cavity. So this is the birth canal, and through this canal it opens to the exterior. Okay, so here you can make out these structures. This one which goes anteriorly towards the anterior abdominal wall and to the lateral pelvic wall. You can see this is the uterine tube. Okay, at the lateral angle of the uterus, you will find the uterine tube or the fallopian tube. Okay, so this is the fimbriated end of the fallopian tube. Okay, this fimbriated end is in close contact with the ovary, female gonad. Okay, it's in close contact with the ovary. So ovary is connected to the lateral angle of the uterus by means of ligament of ovary. So this is the ligament of ovary. So anteriorly, I told you once ligament is going, it's going towards the anterior abdominal wall, and it will form a content of the inguinal canal in case of females. Okay, so it forms a content of inguinal canal in case of females, nothing but the round ligament of the uterus. Okay, so this is the round ligament of uterus. Okay, these two are the remnants of gubernaculum in case of females. Okay, these are the two remnants of gubernaculum in case of females. Yes, and here suspending from the lateral pelvic wall, you can see a fold of peritoneum which forms a suspensor ligament of ovary or the infundibulopelvic ligament because it connects the infundibular part of the fallopian tube to the lateral pelvic wall. Okay. So suspensor ligament of ovary or the infundibulopelvic ligament. The importance is that it carries the gonadal vessels, ovarian vessels. They are carried through this ligament. Okay, that's why it is important. Next, behind it, you are going to see this is the ureter, which goes and opens into the urinary bladder. Next, here you can see this is the rectum and anal canal. So, as the pelvic organs, above there is a fold of peritoneum, serous membrane. So the fold is lining the three structures. So in between the three structures, it will form two folds. So the serous membrane, when it lines the three structures, it is forming two folds. One here, one here. So here it is a recto-uterine pouch. Okay, recto-uterine pouch. This one. Okay, recto-uterine pouch, which is the deepest pouch. Okay, or pouch of Douglas. Okay, it is also called as pouch of Douglas. Next, anteriorly, it is forming the vesico-uterine pouch. Vesico-uterine pouch. After that, it is reflected onto the anterior abdominal wall. Okay? Clear? So here in an MRI, what you can see? Same, can make out this is a sacrum. Up to here, this is the fifth lumbar vertebra. So this is a sacrum with coccyx. This is a pubic symphysis. Here, this one is a urinary bladder. Okay, so this is the uterus, okay, fundus, body, cervix. This is a birth canal, vagina, and here is a rectum and anal canal. Okay, rectum and anal canal. You know, so the difference between the MRI of male pelvis and female pelvis, this viscous is additional here. Okay. So, thank you.